Hi, I'm Dr. Heather Hirsch. Welcome back to my YouTube channel. Today we're going to be talking about a new but old medication to treat bothersome menopausal symptoms that is back on the market. This medication is called Duavee. Duavee is a combination of two medications, conjugated equine estrogens and bazedoxifene. And there's so many properties about this medication that make it really unique and also really applicable for specific populations of menopausal women. If you're interested to learn more about Duavee because you wonder if you're a good candidate or you just want to expand your knowledge on all things midlife and menopause, stick around. If you don't know me, over on this corner on the internet, it is really my passion to teach by giving you knowledge, breaking down myths and misconceptions, teaching you all about the available options used to treat menopausal symptoms. And it's been so much fun. If you like this video, definitely give this a like and consider subscribing. I also now see patients in my private telemedicine practice. Links for that will be in the description below. All right, now I'm going by memory. I'm fairly confident that Duavee was FDA approved in and around 2013 and carries an FDA approval to treat menopausal symptoms including hot flashes, night sweats, and genitourinary syndrome of menopause. What I said in the intro is what makes Duavee a really cool option. It's conjugated equine estrogens combined with bazedoxifene. Now, the bazedoxifene is a compound or a medication that you may not have heard of before, but this specific part of this combination makes this really unique. Bazedoxifene is in a classification of medications called SERMs, or selective estrogen receptor agonists antagonists. Now, a cousin of bazedoxifene is tamoxifen, and yet another cousin is raloxifene, also known as Avista. Many of you might know someone or have heard of tamoxifen before. Tamoxifen is a SERM and a medication used to prevent the recurrence or to prevent primary breast cancer. So because tamoxifen is a SERM, this is really important and why bazedoxifene combined with estrogen is a really cool and novel option. What does this SERM mean like for the female body? Well, again, it's going to act like estrogen in some tissue and then act unlike estrogen or almost like block estrogen at other tissues. So going tissue by tissue, this is really what makes this kind of like a designer hormone therapy, although it's not picture perfect. So it's going to act like estrogen at the level of the bones, which is great because we know hormone therapy is really good for bone health. It's also going to act like estrogen in the brain to help to reduce vasomotor symptoms, which we actually really believe starts in the brain. So that's a really positive benefit, and that's of course one of the reasons why it's useful for menopause and menopausal hot flashes. It also acts like estrogen at the vaginal tissue to treat genitourinary syndrome of menopause or vaginal dryness. This, of course, is really important. It's doing all the things that we want estrogen to do and acting in all the places that we would like it as a medication for menopausal women. Now, alternatively, it acts like an estrogen antagonist or blocker at the level of the breast and also on the uterus. So let's start with the uterus. This is really important because if you still have an intact uterus, you don't want to take unopposed estrogen. That could increase your risk for uterine cancer. One of the ways women commonly avoid this is by taking a progesterone with their estrogen if they have an intact uterus. And if you are a frequent watcher of my videos, you absolutely already know this. But because the bazedoxifene acts like an antagonist at the uterus, it actually means that you don't need to take a progesterone with this combination Duavee, again, which is bazedoxifene and conjugated equine estrogens. You kind of already have the progesterone in one. This is also a really great option for women who have progesterone intolerance or for whom find that they don't like either the micronized natural progesterone or synthetic progestins. Duavee can be a really nice option in the toolbox because you're using the bazedoxifene in place of a progesterone. Now, onto the breast tissue. We really believe and find in animal studies that when using this medication Duavee, the bazedoxifene sort of blocks the estrogen at the level of the breast tissue. Now, this medication does not carry an FDA approval to reduce the risk of recurrence of breast cancer or to reduce the primary incidence of breast cancer because also it's combined with an estrogen in this medication Duavee. But again, in animal studies, we see no increased risk of breast cancer taking this medication Duavee because of that combination with the estrogen plus the bazedoxifene that's kind of like almost blocking the estrogen at the level of the breast tissue. This fun fact has always made Duavee a really good option, specifically for women who maybe have a family history of breast cancer. And even though I counsel a lot of my patients on the sheer safety of hormone therapy, it psychologically makes them feel much better. Or for women who have a high risk for breast cancer but don't have cancer, like a patient with a BRCA1 or a BRCA2 mutation, Duavee is also a really nice option. Again, it's also a really nice option for women who have progesterone intolerance or for whom just want to take one oral combination of both your estrogen and, in this case, your pseudoprogesterone, the bazedoxifene, and call it a day. Just so you know, this video is not sponsored by Duavee. This medication is a Pfizer medication. And one of the reasons we were told that the medication was off the market for the last 2 to 3 years was due to packaging changes. Now, it's illegal to have the wrong type of copy on a package. And so certainly, as you know, Pfizer and many other pharmaceutical companies have been quite busy in the last few years. So there may have been some shortages or some parts in the transit that got stuck, but I'm really excited to say that Duavee is going to be back on the market. And this video itself is really meant to be educational and for you to consider something else in your arsenal of options. Duavee is a once daily oral medication. So for many women for whom I definitely recommend as first line transdermal, this medication may not be a great option for you. So people for whom I do recommend transdermals as first line is anyone with a history of diabetes, hypertension, dyslipidemia, any combination of those, anyone who has a history of migraines, anyone who's had a clot that was provoked, meaning post-operatively or by trauma, anything that puts you at slightly higher risk for blood clot, I would consider you in the transdermal, and then therefore I might not put Duavee at the top of your list. Now, if you remember, I called Duavee sort of like a designer HRT, hoping that we could make it act exactly where we wanted to and exactly not where we wanted to. But Duavee, like all types of hormone therapy, still slightly increases the risk of a blood clot. Now, the risk for blood clot on oral conjugated equine estrogens is about 1 in 1,000. That comes from the WHI, and that comes from oral Premarin 0.625. Now, Duavee is conjugated equine estrogen 0.45, so it's a slightly lower dose, so that risk might be a little bit lower. But please note that these risks are lower than the risk of a blood clot on birth control pills or being post-op or being pregnant. And many women by the time of menopause and midlife who are considering hormone therapy have already stress tested their body along the way, and therefore if you are interested in oral and you want to choose that as your route, it's easier for you, and it's not something that you or your doctor are particularly worried about. Duavee can, again, be a wonderful option. All right, guys, I hope you found this video really helpful. I thought doing a video on this topic would be fun because this medication is coming back on the market. A lot of women were on it and were really disappointed when it wasn't in stock and I couldn't get it for them, and they had to switch to different types of formulations or different types of routes. And again, my mission here is to educate you, give you some more background around things, and break down any myths or misconceptions. So again, teaching only, not direct medical advice. Again, speaking of, if you want to see me as a patient, I have a license in 8 states. Check the links below. If you're not in those 8 states, but you want to work with me, check out the Reclaiming Menopause Masterclass. That's also the link below. That's an incredible course that goes through all this information, a really deep dive, lots of worksheets to do, and I do lives every week with my students, and we have a wonderful sisterhood within our little group. Thank you guys, as always, so much for watching, sharing these videos, and helping to increase this tribe that is telling the algorithm that this place on YouTube is a great source of information on all things evidence-based for menopause and midlife. And I'll see you guys again next week for a brand new video. Bye, everyone.